I believe it's 7 p.m. and this is Thursday, August 25th, 2016. I'll call this regular meeting of the Somervell County Hospital District to order. Let the record show that all board members are present with the exception of Margaret Drake. Ray's going to give the invitation. See you.
Pray with me, please. Father, we're thankful for this day. Father, we're thankful for the way that you blessed us. Father, you blessed us beyond measure. We're just grateful for that. Father, we're thankful for this country that we live in, the freedoms that we enjoy. Father, we just bless those that are protecting us and provide us with these rights and these freedoms. Father, we're thankful that we live in a country where we can focus on the health of others. Father, just pray for those that are delivering those that direct care to the patients, and pray for those that support that. Father, be with this board, be with them as they make their decisions. Make sure that our decisions are all made in terms of what's best for the patients and all that we do. Watch over us and give us direction in all that we do. As we pray in your name. Amen.
Amen.
Good standing. Pledge, please. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, item 5 is executive closed session is will be credentialing of providers. Somervell County Hospital District will convene an executive session to receive report by compliance officer regarding evaluation of medical and health care services pursuant to section 161.032 of Texas Health and Safety Code. It's approximately 12 minutes after 7. We're back in open session. Item 6, in reconvene, discuss and if necessary take action on items from executive session. Do I have any motions?
I make a motion to approve all the reappointments on the attached staff appointment letter, and also remove from the staff Dr. Bilka, Lawton, Osprinski, and also remove the allied health professionals, Grant Kirby and Tony Later.
And do I have a second?
I'll second.
Second by Pat Bruce. Any discussion? If not, we'll call for the vote. You will sign. All in favor? 6-4, no against. Item 7, discuss and if necessary take action on amending or approval of minutes from previous meetings. Everybody have a chance to look.
I've looked over and I'll make a motion to approve the minutes as written.
I'll second.
Okay, motion by Dwayne Griffin, second by Cam Parsons. Any discussion? If not, call for the vote. All in favor? 6-4, none against. CFO report. Becky.
Yes, sir. So we're looking at the July financials, and first thing you see is actual minutes. It looks like we had none. That we had a snafu with pulling some of the information for our reports. So what I'll do is tomorrow when we get that information, I'll add it in here and email to all of you the whole packet so that you'll see what it was. All I know is that the prior month was 34, but I'm not really sure what we did for July. Gross revenue for the month was $3,434,251. Our salaries for the hospital, $449,956 with a budget of $490,876. Our benefits, $109,820 with a budget of $197,758. Our net revenue for the month, $766,697 with a budget of $1,046,566.
One quick comment on the benefits. This is the first month with the reduced benefits that we implemented on July 1st. That's
Yes, you'll
significant difference.
Yeah, in fact, going through this, you'll see some nice looking changes in our expenses, because the expenses were definitely down, not only in salary benefits, but in other areas. So our salaries as a percent of net revenue, if you look at 59%, it doesn't look great, but you have to remember that we're comparing our salaries for net revenue, and net revenue for July was low. So the benchmark doesn't, it looks off, it looks skewed to me. Because as you can see on the next line, budget versus actual, we were down $40,000, almost $41,000 on our salary expense. Ratio of salaries and benefits to net revenue, again, comparing it to net revenue for July, so it's a little bit skewed. It's at 73%. Our expenses for the month, supplies, we were at $105,701 with a budget of $175,056. Professional services, $161,654 with a budget of $158,597. Repairs and maintenance, we were at $21,225 with a budget of $29,152. And our indigent expense, $23,461 with a budget of $34,442. Bringing us to our total expenses of $1,137,612 with a budget of $1,319,789. As you can see, we've had a really good month in keeping our expenses down. Our cash collections, 122% with a benchmark of greater than 98, and again, our days of cash on hand, like June, we're at 8 with a benchmark of 45 plus. Hospital collections, $934,349 with net revenue of $766,609. No, still didn't get it. $766,697. And if you look at our cash flow, you can see on the hospital, we still have a cash deficit of $509,000. Nothing really major happened, nothing out of the ordinary, I should say, happened in July. No ship grants or settlements or loans or UPL, any UPL money. So it was pretty much the basic stuff, like I said, leaving us with the cash deficit. On the 501A, we had a cash surplus of $195,000, and once again, nothing out of the ordinary as far as either our collection or our expense. That's it for the PowerPoint, but if you want to look over the financials for July, they're in your packet. Looking at the hospital income statement, you can see that both our inpatient and outpatient revenue were under budget. We are in our summer months, so that's to be expected. Not great, but to be expected. Our expenses, though, once again, were held down quite a bit, $182,178. And then, as you can see, coming down to the end of the page, the net loss for the month, $42,109. But for the year to date, we're still at $583,118. On the healthcare gross revenue, we were under budget by $188,716, and leaving us with a net loss of $122,439. If you want to look over the income statement or the balance sheets, let me know if you have any questions with any of those.
Or if you have questions after you get home, just contact either me or
Absolutely.
or Becky, and we'll be happy to review it.
And I guess for UC, you want me to just leave that to you when you
Yeah.
get to the IGT part? Okay. That's all I have on.
Okay, anybody got any questions or comments? If not, item 9, CEO report, Ray.
Yeah, I'll start with the last item on the CFO report, and that's on 11-15 funding. We received today our final numbers on our IGP. The first estimate we gave was $1.1 million, then it was $825. Well, the actual number that we'll IGP after the haircut, and the haircut is usually not quite so severe, but it, it's a reduction after everyone sends up their IGP commitments. That amount of money is compared to the available federal fund match, and then a determination is made as to how that's allocated. Our IGT requirement will be $666,774. That will pull down $1,555,341, which will net to us, after we pay back the IGT, of $888,567. Still a significant number for us. And we're, I talked with our consultant today on preparing the funding for the IGT, and he's still working with us on that. So we're still looking at all of our sources for being able to fund the 666. We do have, I may have mentioned this to you, but we do have some additional time to make that. The funding does not have to be set up until September the 2nd. Yeah, so, and then payment on that will come back prior to the end of the year. They did, even though the end of the month. Yeah, thank you. Yeah. Even though they gave us an additional time of about a week to get the funding in, they did not change the funding date. So all funding will be completed by the end of September. So you'll see us continue to work on that, and there's an item on the agenda here, and it'll probably be on all of our agendas until we make it to September the 7th. Any questions on that? Okay. The limited Somervell County Appraisal District 6, really nothing to add on that. I don't have any new information. It's my understanding that the appeals briefs from are due in the appeals court by the end of September. So that's kind of the next date that I'm aware of. There's still been no movement as far as I'm aware of on getting the issue resolved. But hopefully, we're all setting our tax rates this month after we prepare our budget. So it's really going to impact us in terms of where we wind up with our tax rate related to the expected funding from us. Questions on that? I want to talk to you just a little bit about the Rosary Marks Foundation and the work that they're doing. They have gotten organized. They funded a couple of small projects. I don't know if you've noticed the emergency sign on the west side of the drive-through. It looks like some sort of cryptic writing, but the Rosary Marks has agreed to replace that. It's not a huge item, but they've agreed to do that. They also have and one of our board members is here. He is here. Okay. They're working hard to support the hospital. There's a golf course that is scheduled for November the 4th. And all of those proceeds will go to funding the match for the two vans for the senior care. And then they're also looking at other projects. Certainly, Lisa has gotten the committee organized. The committee's working hard and meeting regularly, I might add, and doing a very good job. Appreciate the work that's being done. On the medical management professionals, the lab, our lab project on that, the representatives from MMP, the billing representatives, were here Monday and Tuesday. We've got that pretty well ironed out. We've had some test samples that we've run, and those are doing well. We expect to receive some significant samples starting next week. But it's a program that I want to commend the lab and the business office and the CPSI reps in terms of really getting together, working through all the issues of setting this program up so that we can bill for it and can start generating some additional revenue for us. So we're very optimistic about that. But I think next week we'll start seeing some fairly significant volume coming through on that. Questions? No?
Okay. Item 10, discuss if necessary take action on options related to funding of intergovernmental transfer.
I don't have anything else on that, Mr. Chairman.
Okay, thanks, Ryan. Item 11, discuss if necessary take action on proposals for establishing a 403D retirement plan for Glen Rose Medical Center employees. First presentation by Cliff Prater.
Go ahead, sorry.
Financial advisor for Edward Jones in Massachusetts, I guess that's Massachusetts Mutual. That's Mutual, financial.
Just a quick word on that, just to bring you up to speed. This is one of the benefits is our retirement plan that whenever we left CHC and all of our benefits being provided through them, one of the things that was eliminated was the retirement plan for the employees. I've talked with both representatives here tonight and asked them to come and inform you as to what their plans would be for establishing a retirement plan for our employees. We would still not make a match. The hospital would not make a match, but it would be an opportunity for employees to contribute and prepare for their retirement and prefer some. So first would be Cliff Prater, which you introduced here. You got with.
Yes. My name is Cliff Prager with Edward Jones. This is Dean with Mass Mutual. Sorry, making sure I'm not standing in front of the thing. Appreciate the opportunity for allowing us to come present for you today. I hope that the recommendation we have is something that will fit your needs. I do believe it will. Just to let you know what it is that I do is my job, first and foremost, is to screen the many providers out there and find what I feel would be the most appropriate recommendation for the goals and needs that you expressed to me. And by doing so, that starts with Edward Jones. Edward Jones narrows that down by doing a very strict and a very comprehensive screening process to get that down to just a few providers that we feel are the best in the biz, the ones that are out there to really make sure that we're taking care of everybody the best that we can. From that point, I take those providers and I narrow it down and interview, get proposals, find out who's out there to, I think, would be the best recommendation for you. I've chosen Mass Mutual as my recommendation simply because they are one of the leaders in non-for-profit retirement plans in the industry. They are one of the largest providers out there, and I do think that they're going to be able to meet the goals and the needs that you guys have here at the hospital. The other thing that Edward Jones has to offer, and I have this here as my commitment to your retirement plan. I just have a few copies, but it really is just letting you know that what we have to offer if you use us. And the first and foremost is helping all the employees have a good retirement plan put in place, not just contribute and hopefully that you'll get there. We're going to make sure that they have something in place and that they're on the right track. And the last thing that I'm willing to offer is coming in and doing seminars from time to time. Education, I think education is very important. Letting people know about the different aspects such as Social Security, the different compounds with retirement that they need to know about to get them where they need to be. For the sake of time, I'm going to turn it over to Dean. I'd like him to let you know all the advantages that Mass Mutual has to offer, and we'll go from there.
Thank you, Cliff. Good evening, everyone. Thank you again for the opportunity. I'm Dean Starosowski with Mass Mutual Retirement Plan Services. I'm based out of McKinney, Texas, and I cover Fort Worth and everything west of that. So we really appreciate the opportunity to be here. I know it's getting kind of late in the day, so I'll be as brief as I possibly can be. So we work with independent financial advisors. So Cliff and I spent considerable amount of time kind of analyzing your plan from the information that you have provided, and we certainly appreciate that. Based on the information that we had, I think we kind of understand the goals and objectives of the plan. Sounds like you're trying to establish a 403B for the nonprofit group. Cliff also told me that participant education is important, investments, pricing, and global support. So based on that, we'll put something together for you. I'm going to go over that very briefly, but if I'm missing something out of the goals or objectives, please let me know. Please feel free to stop me at any time. And I do understand we probably have, what, 10 minutes? This is me?
10 to 15.
Perfect, okay. Thank you. Was I pretty much on point with goals and objectives? Is there anything that you guys want to talk about specifically that I could address? No? Okay. So let me tell you a little bit about that.
Just so I'm clear, these are the people that you're addressing over here.
Okay.
So these are our board members, and these people are welcome to
Participate.
This is a group. This is a group we're
Okay.
addressing. You wouldn't have known that.
That's
scoundrels.
Yeah.
that's very helpful. I really appreciate
I
it.
should have given you a heads up earlier.
No worries at all. This was the copies of the proposals. So let me tell you a little bit about Mass Mutual. How many of you guys heard of Mass Mutual before? So we've been around for about 165 years. We've been in qualified plan business for 65, so we're the largest provider of retirement plans in the country. But the reason, I think, one of the reasons Cliff chose us is because we actually focus on retirement plans quite a bit in the nonprofit space. We're actually one of the largest providers in the nonprofit space. And specifically, we have very, very good experience with hospitals. So we have 34,000 plans nationwide, close to 3 million participants. So this is obviously one of the primary focuses of ours. Retirement plans, we do a lot of other things. We're one of the largest corporations, but retirement plans is kind of where we spend the most of our time. Specifically with hospital groups, we have 370 hospitals around the country. So when it comes to hospital group, we have pretty good amount of expertise, and we try to dedicate a lot of resources to those. Some of the most recognizable groups, probably Mayo Clinic. I think you guys are familiar, Mercy Hospital, a lot of different organizations across the country. I think what really sets us apart, and one of the goals and objectives was not only to set up a 403B plan, which is not hard to do, right? Obviously, we can take the highlights from your plan, from the association, and basically write up a new document, and we're going to be able to do that pretty easily. We do this all the time. But from what Cliff communicated to me, the main objective, I understand, is to get as many of your employees to be able to retire when they choose to retire. Is that accurate? So that's the biggest focus. That's where we spend a lot of time and a lot of resources in MassMutual, because we believe that retirement is something very quantifiable. It's not an event that's going to happen, decades from now. It's not going to be a vacation. We look at retirement very specifically. We spend a lot of time and money on data analytics. We think that data drives everything.
Excuse me, let me interrupt just a minute. If you're driving a black Ford, four-door truck, we need to move it, or the MRI truck home.
Can you it's in a no parking spot.
Black Ford, four-door.
Well, I'm driving one too. I'm in a parking spot.
Look, everybody's leaving. Everybody's leaving.
Okay, last one.
Everybody's leaving.
I'm just glad it's not me. That would have been very awkward if I had
Said a white Ford and everybody got it.
Right.
Yeah. So retirement is very important. We believe that the industry up to this point hasn't done a very good job. If you look at the TV ads, all the commercials that are associated with retirement, it's couples holding hands, running into the sunset. It's always on the beach. We think of retirement as something very numerical, something very measurable. And we think of retirement as actually income replacement. So at MassMutual, just because we spend so much time, money, and resources on analyzing the data, and if you think about it, we have all the data on your participants, right? We know how old everybody is, whether they're single or married, when they want to retire, how much they contribute, and how they invest, right? So we have made substantial investments in systems and data analysis to basically run the simulations and calculations to predict the probability for every participant to be able to retire at the age of 67 and replace 75% of their income, okay? So not only we set this goal, but we can actually monitor it, track it, and influence participant behavior to actually get people to get to this goal. How do we do this, right? A lot of it has to do with technology, a lot of it has to do with systems, but the reality is, at the end of the day, it's all about participant education. It's actually sitting down with participants one-on-one, talking about where they at, talking about where they need to be, and actually giving them prescriptive solutions as what they need to be doing to actually get to 67 to replace 75% of their income. With 403Bs in particular, right? With 401k plans, it's pretty easy. It's usually trustee to trustee transfer. The conversion is pretty easy. With 403B, it's different. It's very different, right? It's individual decision for every employee, which means it's not going to be just the wire transfer most likely. So MassMutual, we believe, is best prepared out of all the providers to actually handle that. I think you guys have over 100, close to 200 employees. And if you think about it, how the process is going to work is that once you set up a plan, every participant will have a decision whether to bring the money over here or leave it where it's at, right? And usually when a participant makes that decision, the process could be pretty cumbersome, right? Usually because it's individual rollover, an employee has to fill out the rollover form for the new carrier. They have to get the rollover form, from the previous provider. They have to make that decision. Somebody usually has to walk them through that decision. but the logistics is where the pain comes, right? So knowing that, because we have so much experience with retirement plans and specifically with nonprofit, we have what's called a concierge group, and it's 15 dedicated individuals. This is entirely their jobs. This is all they do. We assign those individuals to every plan, and they actually contact every single participant and complete all the paperwork necessary to bring the assets over if participant or employee chooses to do so. So there's no push, right? There's no, it's not mandatory, but these people are actually there to help to actually, handle the logistics, because otherwise it can be pretty cumbersome and lengthy. Another differentiator we believe from MassMutual is that we actually provide participant education on site. I think we're one of the very few companies that will actually bring fully trained education and fully licensed education specialists to actually sit down with your participants one-on-one and kind of have that conversation about retirement and things like that. And we believe it's pretty important because these conversations, based on all the data that we have, and we measure and analyze everything obsessively at MassMutual, we believe that that's probably one of the most single important factor to determine whether participants are going to retire or not. Because what we've learned is that the biggest factor is the average deferral percentage, how much participant actually putting away, obviously investments and fees. So we want to make sure that all three components are mapped adequately and addressed with every single participant face to face. The way the meetings are conducted, it's not a group meeting. Like I said, we have a lot of hospitals, so we do understand there's multiple shifts, right? So we actually have enough people to come in here and talk to every single participant, so you don't have to pull everyone off of their jobs to meet with our representatives. The result of that, so all the technology and all the one-on-one things that I told you about has this actually work. Plan Sponsor Magazine 2015, they're an independent organization that ranks all the providers in terms of retirement plans. We have the highest average deferral percentage in the industry. It's 8%. If you think how high that is, then considering that we have close to 3 million participants, and a lot of these people, they make anywhere from $8 an hour to hundreds of thousands of dollars a year. The reason people defer more in our plans is because of the data analytics and because of the prescriptive solutions that we bring in one-on-one education. So when our education people come out, they're not measured on how many participants they see or how many meetings they've done. They're measured on what's called action ratio, meaning that as a result of this meeting, your employees, somebody has to do something, either increase their percentage, change their allocation, do something with the plan, and we measure that, okay? And what we've learned, that after the group meetings, the action ratio is about 46%, but when we sit down with people one-on-one, it jumps up to 71. Okay, so 71% of people actually do something as a result of our meetings with their retirement plan. As far as investments, a lot of it is in the proposal. We don't have any proprietary agenda, so right now I understand a lot of you guys utilizing Fidelity funds. Fidelity is one of the fund managers that we're going to be able to bring to your participants. There's probably 40 or 50 to choose from, a couple of hundred different funds. So one of the things that Cliff is going to bring to the table is going to kind of narrow it down to a manageable number, so your participants don't have to navigate through 200 options. Right, and we're going to make sure that all the asset classes are covered. With that, we're also going to offer what's called the fiduciary protection on the plan level. The pricing, it's tiered pricing because it's individual rollovers. We don't really know how much in assets is going to come in. The number that we had was, I think, $3 million and 150 employees. Right. So if it was $3 million, I think we could be around 1.1, 1.15. As far as the plan document work, who's going to write the plan document? We suggest that you utilize a third-party administrator. Nova 401k, they're based out of Houston, but they have a full office in Dallas, and they have two, I think, in Austin and San Antonio. That's their specialty. That is what they do. So they're going to write the plan document. And if the assets are $3 million, so not only are they going to write it initially, but they're going to do all the compliance and filing and everything else that needs to be done. It's another 10 basis points to our pricing, which is 0.1%, probably getting you to 1.2, 1.3 all in. So if we get $1 million, it's going to be a different pricing because it's a percentage. So that's everything is in the proposal under costs. tab, and everything is, fully disclosed. Did I?
You're up, about time.
I was worried about that, so.
Questions?
Questions?
Yeah, are you saying that it's gonna be 1.21% rollover? Is that what you're saying?
So there's not a hard dollar cost to the organization. If
I mean,
you-
to the individual.
To the individual, probably, yeah. So if and we're looking again on asset bands, right? So if it's $1 million, it's gonna be higher than that if it's $2 million. But we assume or issued the pricing assuming that we're gonna have $3 million. If we get $3 million, our pricing is gonna be around 1.1, and the TPA, or the compliance, the plan document, is gonna be another 10 basis points, so about 1.2. And this is average, right? It also depends on what funds you select. So I mean, are you gonna select a lineup that's indexed and expensive funds, or are you gonna select some funds that are maybe more expensive, more actively managed? So we don't have a proprietary fund requirement, we don't have a fund agenda, so this is gonna be up to Cliff to select the fund lineup for you. And we believe it has to be merit-based. It shouldn't be based on input from the provider, right? Because we have to be unbiased. We have to do. We focus on participant education, providing investments, providing participant tools, things like that. Education, fiduciary protection.
What type of maintenance do you do every year?
That's it. We don't really have any maintenance.
You know what I mean?
You do have the ability, instead of doing the percentage, do a hard dollar fee for the TPA services, meaning for the plan document, for compliance, for the ongoing services. So there's complete flexibility as to how you want to pay it. So we just thought a percentage would be. I think Cliff said that the intention was not to have a lot of hard dollars expenses to the hospital. So the way we showed the proposal, everything is on a percentage and everything comes out directly from the employee's accounts. That makes sense?
Is that the best number you can come up with?
Probably. Well, I can tell you that this is the best number we give, right away. The only way this number could go down if Cliff picks some inexpensive funds. So yeah, the number could go down. Depending on the investment philosophy, right? If you're picking some index funds, it's going to be pretty expensive. But if you're picking some of the target date funds, that could be more expensive than others. But you also have to look at performance too, right? So it's kind of a combination of performance and fees.
What type of fees do you have for your clients that are already influenced, if they want to move from one fund group to another?
Within the individual investments, there's no fee. So within the plan, you can change investments. It's fully participant-directed account.
So if they go from Invesco to Fidelity, there's no exchange.
Right, as long as they're staying within the plan and asset control, there's no money you can pick. We don't have a proprietary requirements.
Are there any funds you don't include in your group?
You mean any particular fund managers?
Or
Yeah, so I can
a
tell.
group of funds that you
Yeah.
don't include?
Yeah, so that's actually a really good question. So this is the due diligence process that we do in conjunction with a company called InvestNet. They actually sign off as the co-fiduciary on this plan. What they do and what we do, we actually analyze the entire universe of funds, right? And we actually do the screening on an ongoing basis. And they look at the qualitative, quantitative factors. They look at the tenure, how long they've been around. They look at consistency. It's really quite a process. The analogy that I use, instead of picking one fund family like you have right now at Fidelity that may be good in certain asset classes but may not be so good at others, I use the all-star analogy. So if I was a coach and I had to put an all-star team together, right? I happen to be a Chicago Bears fan, so if I would be inclined to invite as many players from Chicago as possible, but I also understand that maybe quarterbacks should be invited from someplace else, possibly from Green Bay, right? With an idea that if you are putting an all-star lineup, you put the best player in each position, doesn't matter what the jerseys say. This is the same thing we do with the lineup. So if we think that American Funds, for example, or Fidelity is very good with large caps, let them do it. If PIMCO is very good with bonds, let PIMCO do it, right? If Franklin Templeton is very good, or Oppenheimer with some of the international funds, let them do it. It's all merit-based, right? We're not married to any particular fund company. We do own a fund company, as a matter of fact, Oppenheimer, 100%, so that's the affiliate of ours. But it doesn't mean that you have to use Oppenheimer funds in this fund. You may have 0 Oppenheimer funds in the plan. So, and consequently, if you do have a lot of Oppenheimer funds, there's not a price break there, because we're trying to be as unbiased as possible.
Anything else?
Do you want to elaborate on that fiduciary protection?
Yeah, it's called the 321, fiduciary protections. Basically refers to the ERISA code. There's a couple of levels, 321 and 338. The 321 actually comes with this pricing. So, and the company that provides that called Investnet. So they're one of the largest providers of fiduciary services. So, but that's, I think that the value really, because a lot of companies can provide funds and websites and and all the print statements, right? I think the value. What's going to be important for this plan is the concierge service, people who are actually doing paperwork for every single employee, and also people who will be coming here doing one-on-one and group education and things like that. To us, that's, and then the data analysis that we do, right? So like we analyze the data, we have the systems that do that, and things like that. So when you go on the website, and by the way, you'll have all these tools on your smartphones, Android and app, you can access your account pretty easily. When you go on the website will basically tell you the probability of you, because we know how much money you make and where you at. It will tell you the probability of you retiring at the age of 67 and replacing 75% of your income, and then it's going to give you an alternative scenario to get you closer to that goal, and it will show you the risk, right? It may get you closer, but you may assume or may take on a little bit more risk. So everything is very much data-driven, and I think that's probably one of our biggest differentiators, because a lot of our competitors kind of wing it, right? And we just don't feel that has worked in the past for plans in this country. So,
Anything else?
Yep.
Thank you very much. Thank you.
Thank you very much.
Thank you.
Appreciate it. Thank you.
Okay, the next presentation by Randy Robertson, Senior Financial Advisor for Wells Fargo Financial Group Network.
You're not working,
Not today.
Thank you.
If you look inside your folders on the left-hand side first, the first page there is basically a biography. Tells you something about me. First of all, I want to start off and say thank you for allowing me the opportunity. I've been looking for this day for 16 years. Obviously, when I started at Edward Jones, this was one of the first places I went to see if I could get their retirement plan. So I welcome the opportunity and thank you. And also I want to thank each of the board members. I've been where you are, not necessarily in this board, but in other community boards. This is a thankless job, and I want to make sure that you get thanked. Thank you all. I know we've been through some rough times with recent boards here. I appreciate each and every one of you stepping up and stepping forward. Hopefully we'll get everything back on a great track going forward. Within the folder, I'll just touch some of these things very, very quickly. But you'll see my bio. And then after my bio, you'll see a very, very short, basically 6 slide PowerPoint. I didn't bother to put it on the screen, just give it to each of you exactly. And so let me just start off with that. And so if you look at this, at the bottom of the first page, it says vendors. I didn't come with a particular vendor tonight. I do have a proposal for you. But listed there are 5 individual vendors that we can choose, we can use, including Mass Mutual, and I believe you're my wholesaler as well. So we can use Mass Mutual if we want to. The key tonight, in my opinion, is who you're working with, not necessarily which provider or vendor you're using. Mass Mutual is great. I set up a plan with Mass Mutual, another company here has it. Back to your question, Pat. Once you set up the 403B or the 401K, the advisor has the opportunity to select about 50 funds. That may change depending on the provider. After he selects about 50 funds, those are the funds then that the employees can use. All right? Those funds can be changed, but basically it's that 50. So it's not like you're going out there and looking at 4,000 funds to choose from. Okay? It's usually a group of 50 or so that the employees will actually invest in. Those 50 funds will come from all different fund families. There's typically somewhere on the order of 20 to 30 different fund managers, whether you're speaking about BlackRock or Franklin Templeton, Oppenheimer, American, the list goes on and on and on. What you're doing is you are picking the best of the best, and you're absolutely right, that's what we do, we pick an all-star team. Because any all-star team is going to be an individual fund family. The next slide on the next page, it's about your 401, 403B plan. This is a fee-based system. Now, if you haven't heard, the Department of Labor in April has determined that all retirement plans starting April of next year will be fee-based. No exceptions. All right. It will be fee-based. Again, just as we talked about earlier, it's going to be based strictly upon how much money comes into the plan, how many employees there are, what's the average size of the account holdings. It'll vary anywhere from 0.5% up to 1.5%. If you have very, very few employees, very, very small accounts, it's bigger. If you have lots of employees, lots of accounts, big accounts, not 2,000 or 3,000, but 20 and 30 accounts, then that goes down significantly. Okay? That's also negotiated. Okay? So we'll come up with a proposal based upon what we end up getting, and then we can come back and negotiate what that price is. Okay. The plan is flexible in the sense that we can bill it to the hospital, medical center, or we can bill the participants. That's your decision. That's something that can also be changed. So if you start out now and you need to have the participants pay for their services, you can. If in the future you want to have the medical center pick up the tab for everybody, then we can change that later on. Either way, flexible. There is also a loan provision on the 403B. And what that is very, very important is it allows your employees, if they get into a financial situation, they need money, be able to loan against their account, okay, and put money back in. All right. Now, typically what happens is if you don't have a loan provision, a lot of people won't contribute because they need that money. And so loan provision is very, very important to have in your retirement plan so that the employees can take a loan if they need it. Now, there are some requirements and everything else, but that provision is there. Then I want to get right down to the proposal. You currently have 3 different retirement plans. You have one that's with Principal right now. It's here. You have 2 others that used to be with CHC, a 403B and a 401. Okay? My proposal would be, at least initially, is to move all of those into the Principal. Okay? That way you've got one group that you're dealing with on terms of all 3 accounts, all 3 retirement plans. That'll also help you with some pricing because you've got 3 rather than just 1. All right? Now, at some point in the future, if we decide that there's a better way or a cheaper way to go, we can certainly look into that. But initially, I would go with principal for now, because you already have one that's already set up with principal. You already have the history there. Okay. It also allows all three plans to have one financial advisor. You can work with all three plans and work with one group. The part that Cliff mentioned is very, very important. It's the thing that's missed out on a lot of retirement plans, is the opportunity to actually sit down individually with each employee, map out their risk, map out their goals, and to define a retirement plan individually for each one of them. And honestly, that's what you're getting by getting somebody local. If you get someone, typically like you've had in the past, they're far away, they may take the opportunity once a year to come see whoever shows them that one year. I'm literally right across the street. Anybody can come see me anytime they want to. Now, I will also attempt to set up meetings with individuals as well. Now, I kind of have a 24/7 policy. You just tell me when, where, and I'll be there. So, time is not an issue. All right. The last two sheets, the last two slides. Again, you can read into the bios and everything else. You know I've been here for a long time. You know what I've done. You know me, and you know how I've been involved in the community. This is our wealth management group. It's composed of myself, my wife Angie, who most everybody knows, my senior assistant, Carissa Mueller, and Marilyn Whitesell, which also works for me, but she's not available to be here. She's actually going to Kansas, taking her mom back to Kansas sometime. That's us. Now, there's a lot of probably unanswered questions, so let me just kind of cut through a couple of them real quick. I can hear them. You were with Edward Jones for 16 years. Why did you leave? Especially at your age. Okay, well, number one, it's a fundamental decision. Edward Jones is changing. I'm not going to say for the worse. I'm not going to say for the better. I'm just going to say they're changing, but they're going in a direction I didn't want to go. That's it. That's about as simple as I can make it. What I did by being affiliated now with Wells Fargo is I now have a platform and a company behind me that's bigger, stronger, has more assets, and more capabilities than I had at Edward Jones. At Edward Jones, in our advisory solutions, we had a choice of about 150 funds to pick from. At Wells Fargo, I have a choice of 4,000 funds to pick from to put in our advisory services. You talk about an all-star team. You want to pick an all-star team from 4,000, or you want to pick an all-star team from 150? I chose Wells Fargo because it offers my clients much more advantages than I currently have at Edward Jones. That's the bottom line. I didn't get kicked out. Nobody got mad at me. I chose to leave because I thought this was better for my clients. That's it. That's short. Okay. Now, unfortunately, this comes several times, so I'm going to address it because I've got the gray hair. I don't intend to retire. I've told this to everybody who's ever been a client of mine. I don't. My best scenario is I'm going to die at my desk. I love my job. I love what I do. I love helping people. You can see from my community involvement. I love this community. I'm a fourth generation Somervell County resident. I love this community. I'm not leaving. I'm not going anywhere. Okay? If something does happen to me, if I die, what happens? I already have an arrangement with Wells Fargo that they will take over my office. Someone else will run it. Everything is already set and in place in case something should happen. Okay, it's no different than what I had at Edward Jones. Somebody's going to replace me. That's not a problem. All What you're dealing with tonight is who you want to work with. It's not picking a vendor. Let me be clear about that. I got 5 we can pick from. I actually have more. I actually believe there's a Wells Fargo retirement plan that I can do. There's also a Fidelity plan that we can do with Fidelity. Now, I don't have all the details to tell you tonight whether or not that's feasible. To me, right now, I think the best option for you is to go with the principal, because you already have a plan set up with principal. One, I set up the other 2 with principal as well. You get the synergy of having all 3 in the same plan, same title, same organization. All these companies, no offense, whether it's Mass Mutual, whether it's Prudential, whether it's the principal, they all have people and assets that will help us set up the system. That's all pretty much standard with every one of these major groups. Now, there are some smaller groups you don't want to deal with, but these major groups that we're talking about, it's pretty much the same. So your decision, as I see it tonight, is to decide who you want to work with. That's plain and simple. And whether it's me, whether it's Cliff, whether it's somebody else, that's your choice. At that, I'll answer any questions that you might have.
What type of Morningstar rating do you look for in funds?
That is a super great question. I typically look for long-term Morningstar ratings of 4 and 5. Okay? Does everybody know what a Morningstar rating is? Okay, a Morningstar rating is done by a company called Morningstar. They look at individual mutual funds and they rate them based upon the performance history, based upon their risk analysis of what they're actually investing in. They look at how long the managers have been there, whether there's been a lot of turnover of managers, etc., and they give them a rating, just like you do with restaurants or anything else, or hospitals. So you get a rating basically from 1 to 5 stars. 4 and 5 obviously are the best. And bottom line, what that means is those 4 and 5 stars in amongst their style or their peer, okay, are the best in that class. So if you have a fund that invests in large companies that pay dividends, it compares all those similar funds. They don't compare with something other else. They compare just within that group. And if you get a 4 or 5 star, that means you're outperforming the 1, 2s, and 3s. Okay? Any question? Anything else?
I only have one comment for both of you. It's not anything bad, but we've asked our employees to sacrifice a lot up here.
Yes, you have.
And frankly, anything over 0.8%, I think is doing an injustice to our employees. They have had to make a lot of sacrifice.
Totally agree.
Thank you, Linda.
And to me, it really matters not whether it's $1 million or $3 million. It's a sacrifice they had to make. So I want you to consider that
Well, we
when you're
understand.
calculating your percentage.
We fully understand that. And again, what I was proposing is strictly negotiable. Okay?
That's my negotiation right there.
All right? That's good. I have no problem with that.
Okay, any more questions or comments? Entertain a motion. I would think that probably what we ought to do is appoint a committee with 2 or 3 members to head up looking at both these proposals. Have any volunteers? Pat? Appreciate it.
Okay.
Anybody else want to volunteer? Okay, Pam? Y'all feel like 2? Y'all want to go with that, or?
Let's get 3.
Okay. Anybody else want to volunteer? I'm a word guy, not.
Why are you looking at me?
Yeah, okay, thank you. let's have a committee of Pam and Pat and Dwayne to spend some time and let me find time to spend. And Ray, probably with your help or anybody else in the hospital can give some guidance. And y'all come up with a recommendation, come back to the board. Okay? Good. Okay.
Everybody know what we're looking for?
Okay. That brings us to item 12, public comments. We have some members of the public. Anybody there?
Thank you.
Thanks a lot.
Anybody that's here from the public want to make any comments?
Jeff?
Okay. All right.
Before we move to the
Sure.
next, I want to make a comment and a request. Ray has worked extremely hard, and it's been brought up here, the cuts that the employees have made to make this hospital stay, and we appreciate it very much. With that being said, I think there's other areas that we can look at that, as a board, we should look at to save money. I request a special session that we can look at and possibly review the doctor's contracts. And as a separate item, I'd also like to put in there that we look at adopting an SOP for clinical operations. And possibly appoint a committee to look at both of these options.
Okay. Anything else?
No action to be taken on that, but I'll make sure that it gets addressed.
I think we need 3 board members just to make that request, and I'll be one.
Sure,
Okay.
absolutely.
We got a volunteer. All right, if there's nothing else, I'll entertain a motion to adjourn.
I'll make a motion to adjourn.
I'll say.
Okay, I believe Pat got that one first, motion, and Dwayne second. All in favor? 6-0. Thank y'all.